Good evening. I'd like to thank Bandra Gym and Dr. Cheryl for inviting me again to do a second part of the conversation that we had about 2 weeks ago. The idea being how to stay calm during the COVID pandemic. So I would like to start off with a brief summary of what's happened since we spoke about 2 weeks ago, look at where we stand in terms of the current scenario, and specifically answer questions that people have sent me through Dr. Cheryl, through Instagram and on Facebook. So if you just start off with looking at the raw statistics, yesterday Mumbai had about 1,380 cases with 69 deaths, which is quite high still. Maharashtra still had about 3,400 deaths, 3,400 cases yesterday with about 113 deaths. The mortality still stands at about 3.7%. So 3.7% of those who test positive do not do well. But there are a lot of positives that have happened as well. So Dharavi, for the first time, had only about 17 cases yesterday. There is a whole story about how they've done a really good job at trying to contain the epidemic within Dharavi. And let's look at what are the different policy changes that have happened and what are the different statistics that are encouraging since the past 2 weeks. For the first time, India has had a higher number of recovered cases than the number of active cases. So the total number of recovered cases since day one has for the first time crossed the number of total active cases that have happened since day one, which is a very good statistic worldwide in terms of hoping that the pandemic is kind of turning around, hoping that things are starting to slightly get better, hoping that the rate of recovery is higher than the rate of new cases. There was an ICMR seroprevalence study which was published about a week ago. Now, what does seroprevalence mean? So when you get the infection, hopefully after about 2 weeks after getting the infection, you have antibodies in your blood. And these antibodies, when measured and present, tell us that the person has been infected in the past at some point of time. So what they did was they went across the country in different places and they looked at what the prevalence of antibodies in the population was. So these were not symptomatic people. These were people just randomly selected from the population. And they looked at how many individuals had antibodies. What they found was that in certain containment areas, in areas of high density, the number of people who had antibodies were as high as 100 to 200 times the number of cases that were recorded in those areas, which in a way is a very reassuring statistic, which means that for every one person who had symptoms and who was actually tested and who was therefore labeled as being a case, they could have been about 100 to 200 individuals in that community who had an infection, who didn't even know they had that infection and developed antibodies to it. Basically, what this means is that the true number of cases in the community may be far higher than what we are seeing, as a result of which it becomes more and more reassuring that the ones who do get symptoms, the ones that do end up in the hospital, end up being a minuscule fraction of the total number of people who get infected. So it's a reassuring statistic in that even if you do get infected, a very tiny proportion of those who get infected possibly end up in a hospital, possibly end up having a poor outcome or a complicated disease process. The World Health Organization announced that asymptomatic patients, patients without symptoms, do not transmit the disease. Now, this was a problem. This was a problematic statement from the World Health Organization. What they meant was, if you do get infected, you don't have symptoms, and you remain asymptomatic, so you remain without symptoms for a long time, these individuals are very unlikely to transmit to others. The problem with that is that you could be in the pre-symptomatic phase. So I don't have symptoms today. 3 days down the road, I actually get fever. So I'm asymptomatic today, but I don't continue to remain asymptomatic. I am in the pre-symptomatic phase, and you can very well transmit the virus during the pre-symptomatic phase. So if, I've seen a video being circulated online on WhatsApp saying, they fooled us all along and we've unnecessarily done a lockdown. If you don't have symptoms, you're not going to transmit it to anyone. I think that was a misinterpretation of the World Health Organization statement. And I think the WHO as well came out with a clarification the next day saying that this applies only to individuals who get an infection, remain without symptoms, and continue to remain without symptoms, never get symptoms. The problem is that this is a very useful statistic in terms of knowledge, in terms of academic discussions, but it does not have any value in terms of our day-to-day lives. So if I don't have symptoms, does that mean that I can not wear a mask and go out and I will not transmit to others? No, the answer to that is a very firm no. because you never know that you may get symptoms 2 days down the road. And we know that 1 or 2 days before, or 3 or 4 days before getting symptoms, people can definitely transmit it to others. So nothing changes in terms of our overall knowledge. We still need to take precautions in terms of, number one, wearing masks ourselves and making sure that people around us wear masks as well. Another thing that has changed is that the ICMR, which is the Indian Council of Medical Research, has now sent out guidelines saying that asymptomatic individuals who are contacts can also be tested. And this is a slight change from the earlier guideline. So earlier, the government was allowing you only to get tested if you have symptoms. They have relaxed that a little bit now. So even if you don't have symptoms, you want to get tested, you need a prescription from your family physician or a physician, and you should be able to get yourself tested if you want to check for some reason. So that's in a way a step forward for individuals who found the existing guidelines very narrow and very stringent and focusing only on individuals who had symptoms. So I think there are a few positives that have happened in the past few weeks, and there is a lot of hope as a result of these positives. Of course, we still are in the midst of a pandemic. Our numbers are still rising. The number of deaths are still rising. So we are nowhere close to the point at which we can relax and say, the worst is over and we can move on and start living normal lives. We still need to take all the precautions that we have taken over the past 3 months. But there's no reason to lose hope. There is a lot of hope on the horizon. What about my personal experience? So it's been 3 months now since we've been working in the COVID wards. What I notice now is that the patients that we are seeing now tend to be of a more severe category. There are more people who require oxygen more, people who tend to have more complications. And this is a reflection of the fact that more and more individuals who do not need a hospital are choosing to stay at home. And this is great. This is excellent news. This is what we spoke about in my first talk as well, that home quarantine is the way to go. If we home quarantine more and more individuals who don't need a hospital, there will not be a shortage of hospital beds. We will be able to serve people who really need hospitalization. We will be able to serve the sicker patients better, while the ones who are not so sick can be very well monitored at home under home quarantine. So again, I'm going to reiterate the same point that I think we need to encourage home quarantining in our societies, in our communities. We need to support individuals who home quarantine so that they are monitored regularly, somebody calling them up, making sure that they are fine, and then shifting them to the hospital as and when needed, but staying away from this concept of every corona patient, every patient with COVID needs to be hospitalized. I think the more we go away from this concept, the better we will serve individuals, the better will be the utilization of our healthcare resources. So let's talk about a few points which I'd like to reiterate. What about in terms of home quarantine? So say you do get positive, say you have fever, you get a throat swab done. I cannot emphasize the importance of getting a nasopharyngeal swab done as soon as possible. So earlier, there was a lot of reluctance to get swabbed because the moment you would get swabbed, your building would get sealed. Uh, Societies were not very okay with the concept of people staying within the same building. I think that's gradually changed. So there's no sealing of buildings anymore, to the best of my knowledge. You can very well stay in your home comfortably. I think more and more individuals in the community are realizing that it's not them versus us. It's not a disease that affects only a particular type of people. And therefore, there is more and more acceptance to you staying at home. And I think home quarantine is something that's more and more accepted. But you can home quarantine and you can protect yourself and others only if you get tested. So if you do have symptoms, I cannot emphasize enough how important it is now to get tested. Uh, it has become relatively straightforward to get tested. Nasopharyngeal swabs are offered by a lot of different diagnostic centers, hospitals. Getting tested, the turnaround times have improved. Earlier, it used to be 3-4 days at some point of time. Nowadays, at some places, you test yourself in the morning. By the evening, you get your report. You know where you stand, and you can take action accordingly in terms of protecting yourself and protecting your families. What are the things that I would recommend if you home quarantine? If possible, you should have a pulse oximeter. So it's a small little device which you apply to your finger, and it gives you a level of oxygen in your blood, or what we call the oxygen saturation. I think this is very important to do. So especially if you're an elderly person, especially if you have comorbidity, especially if you have other diseases. Pulse oximeters, again, to the best of my knowledge, have not gone out of stock. They are still available. Most chemists will have pulse oximeters. They are not too expensive. And that's a very useful tool for a home quarantine. So I am at home. I know I have corona. I'm keeping myself in a particular bedroom with an attached toilet. I'm wearing a mask at all times. I am not I'm avoiding any interaction with the family. Others in the family are wearing a mask whenever they interact with me. And I am monitoring my oxygen levels constantly. When I say constantly, it could be about 3 or 4 times a day. And you make sure that the oxygen levels by and large are above 95. If they fall below 95, that's when you would possibly want to get admitted to a hospital to be observed and to make sure that you are under constant observation. The other thing that you would need for home quarantine is a thermometer, just to make sure that fever at some point starts settling. There is a group of individuals, there's a small subset of individuals who continue having very high grade fever, high, 101, 102 fever, even after 10, 11, and 12 days of falling sick. And these are the individuals who need to be monitored very closely because, continuously having fever would mean that your body is launching a very strong immune response, and you might need to be in a hospital for that. You might need some medicines to calm that immune response. So therefore, thermometer along with pulse oximeter are the two devices that you must have if you are home quarantining. Hand washing, of course, remains the backbone of home quarantine. You frequently wash your hands. Everyone in the home gets completely paranoid and washes your hands constantly, just making sure that you don't spread it to others in your house. And of course, wearing of masks. So a simple mask that you can wear, and ideally everyone in the house wears masks as well. So four keys to home quarantining: pulse oximeter, thermometer, hand washing, and masks, I think are the key to a successful home quarantine. Again, if you understand the dynamics of the transmission of the virus, most of the virus is transmitted in prolonged close contact. So most of the studies, in fact, have looked at about if you stay with a person for more than 15 minutes in close contact, that's when the probability of transmission is really high. So even if you're home quarantine and individuals come, there is a quick contact of giving you food, casual contact here and there for things that have to be done. Say you need to take medicines and somebody comes and gives you those medicines. That person, the relative of yours or your friend or whoever's with you, is wearing a mask, you're wearing a mask. The probability of transmission still remains very low if it is a short, quick contact with both the individuals wearing a mask. So I think these are the principles of home quarantine. The next thing that I'd like to talk about is unlocking. So clearly the day things unlocked, everybody was on the street. A lot of people were on promenades by the sea face. I think there are enough photographs on the internet and in newspapers which have shown people going completely out in the open and assuming that unlocking means that you can go all out. Um, I think this is a little more complex than it seems. So I think all of us need to understand, number one, that unlocking was not a scientific or a medical decision. It wasn't that we were confident in any way that things are a lot better and therefore we unlocked. Unlocking was a purely economic decision. We realized that we could not sustain being locked in forever in terms of economics. People had to start going to work again. The economy had to be revived. And that's where unlocking had to happen. The concept of a lockdown was to prepare us medically, to prepare us in terms of infrastructure, such that when we had enough infrastructure, we would be able to unlock. The government, the BMC, seems reasonably confident that we do have that infrastructure now. There are enough hospital beds, there are enough quarantine centers, there are enough step down centers that would be able to serve the city of Mumbai. However, that is going to succeed only if things remain under control to a certain extent. If things completely explode, I mean, even the best places in the world have been overwhelmed. Look at what's happened to New York. Look at what's happened in Italy. Uh, First world countries who could not handle it because their systems completely got overwhelmed. So I think this is where we have a sense of responsibility, that we know that an unlocking has happened, but yet we need to behave in the most responsible way to make sure that we don't pay a heavy price for this unlocking. We would pay a heavy price economically if we had not unlocked, but we will pay a heavy price medically and in terms of lives if this unlocking ends up being a fiasco in terms of everyone being on the street and transmitting it. So from a perspective of an epidemiologist, when you talk about probabilities, you talk about three things. You talk about an agent, which is like the virus. You talk about a host, which is an individual, and you talk about the environment. And I think these are the three ways in which you need to look at unlocking. So when I decide to step out of my house, I need to look at the coronavirus, which we said spreads in close, prolonged contact. So if I do walk on a promenade, everyone's walking in a disciplined way, which is about 6 feet apart from each other. You keep a reasonable distance between people. You do not stop and sit down and chat with your friends. If you make sure that you're doing that, your risk is less in terms of the virus. Then you look at the host, that is the individual. So if I'm somebody who has diabetes, who has high blood pressure, who has heart disease, my risk is going to remain higher than somebody who doesn't have any of these. So I would want to be a little more cautious about going outside. And then you look at the environment. So if you're in a green zone, if you're somewhere else, if you're not in Mumbai, you're in some other city which is in a green zone, and the probability is low, then yes, maybe you're at a lower risk of going outside. So I think you need to be cognizant of these features. You also need to be cognizant of the fact that if you have elderly individuals at home, if you have individuals who are immunocompromised, so somebody say who's on cancer chemotherapy, somebody who's on dialysis who's at home, you would want to be a little more cautious about going outside because you might sail through it. You might go outside, get infected, come back, you might be fine. But the person at home might end up suffering for you going out and not being cautious. So again, if you go out, if you decide to go for a walk, because I do understand that inactivity is also a predictor of heart disease. So the longer you stay inactive, the longer you stay sedentary, that's not good for your health as well. So of course we have to balance this whole need to exercise, this whole need to go out, this whole need to not get mentally depressed. We have to balance that out with the risk of acquiring the virus. So I wouldn't put a blanket statement that we should, despite the lockdown, we should continue staying at home. But I would suggest that everybody kind of analyze these things when they do decide to step down. If you do decide to go for a walk on a promenade, maybe you initially test the waters by, for the first week, go for just 10 minutes every day at different points of time during the day. Try and identify what's the best time of the day when you see the fewest number of people who are outside, and try and titrate that time as being the time when you go for a walk. I think all of us need to contribute towards trying and making it as low risk an event as possible. So if I know people generally prefer to go at 7 in the morning for a walk or at 5 in the evening during a walk, but if everyone has the same preference, that's not going to help people. So I think we need to be a little sensible about it, and I think we need to accept the fact that we are social animals. We do like to go outside, but at the same time, we need to do it in the most prudent way that we can. So those are my broad points in terms of how to manage the current scenario. I would now go to specific questions that people have asked me. So one of the questions that I keep getting asked very often is, what kind of mask should I use when I go outside? So again, the concept here being, when you go outside, you are going outside with the presumption that your encounters are going to be short and quick. You're not going to have a prolonged encounter with an individual. Those encounters will be at a distance of 6 feet. Hopefully, you will not be in somebody's space for a very long time. And if you take those presumptions to be true, a simple cloth mask would work very well, because it in terms of suffocation, in terms of the symptoms that it of discomfort that it would cause, it would be the least worrisome. But you must remember that this works only if those presumptions are true. So if you're wearing a simple cloth mask and you stand very close to a friend of yours, both of you are wearing simple cloth masks, uh, talk, keep on talking for a period of 15 to 20 minutes, your risk is going to be quite high. So for quick, short encounters, I think a cloth mask works in terms of being very comfortable. If you're going to trade off comfort versus being absolutely cautious. Now, if your risk is a little more for some reason, if you're going to visit someone uh, who's unwell, for example, and you want to make sure that you protect the person to the best of your ability, and for some reason you have to be in contact with that person for say 15 minutes, you still maintain physical distancing, but maybe a 3-ply surgical mask. So this is what you need to ask your chemist. You say, ask for a 3-ply surgical mask that offers a greater level of protection. Now, if you want to go to the next level of protection, that's where you would use a mask called the N95 mask, which is what we as healthcare workers working in a COVID ward use. Now, I would not recommend this mask to be used by everyone for multiple reasons. Number one, you would want your healthcare providers to have access to these masks when there's a shortage, and therefore you wouldn't want to hoard on these masks among people who really don't need it. Number two, these masks are very uncomfortable. So I work in the ward for a number of hours wearing this mask, and it is extremely uncomfortable at the end of that. Your oxygen levels in your body dip a little when you use these masks, because the seal is so tight that you're very often rebreathing your own air and you're not getting fresh air. So you wouldn't want to do it unless there is a strong reason for you to wear an N95 mask. The other thing that I would want to kind of point out is that you have masks with valves on it. So what these valves do is that they are unidirectional. So when you breathe out, the air that is exhaled, the air that you give out is not really filtered. It goes through a low resistance system, so it goes out quickly into the air so that you get fresh air the next breath. Now, while this may be very comfortable for the person wearing it, it can potentially lead to a higher risk for the person not wearing it, because every time you breathe out, everything that you breathe out is going out almost unfiltered. Every time you breathe in, you're getting you get the protection of breathing through a filter. So again, it's something that worldwide people are discouraging more and more from a community perspective, because it's kind of being a little selfish in terms of choosing your own comfort over the health of people around you. So using a mask with a valve is something that you need to be a little cautious about. The second question that I got asked was about pregnancy and corona. Now, to the best of our knowledge, pregnancy does not increase your risks of having a worse outcome, either for the mother or for the child. But the caveat there is that it does not carry a lower risk either. So if you are pregnant and you do acquire the virus, your risk of having a severe disease, your risk of needing to be in a hospital, your risk of being put on a ventilator, for example, is will almost be the same as the risk of anybody else in the community, which is not trivial, which is not so small that you ignore it. So therefore, I would suggest that you take the same precautions that anybody in that situation would take. You do not want to get the virus, just as anybody would not want to get the virus. Now, there were certain viruses like H1N1, which for some reason had a worse outcome among pregnant women than among individuals who were not pregnant or males. Now, this does not seem to be that kind of a virus, so it doesn't seem that you have an increased risk, but nevertheless, you need to be as cautious as possible. What about transmitting it vertically? We call it vertical transmission when it goes from the mother to the child in utero. Again, there are reports of newborns having the disease, but it's very difficult to know whether they've had the disease as soon as they were born because their mother was positive and they instantly acquired it at that point of time, or they acquired it while they were still in uterus. So some of the studies which have looked at the placenta, which have looked at other fluids, did not find much of virus in all of did not find any virus in those fluids, suggesting that maybe the transmission happened after the baby was born. So it doesn't look like it's transmitted to the baby while the mother is pregnant. So I don't think there are any specific precautions that need to be taken as far as that goes. The next question, which gets asked often again, is what about relapse? I've got infected, I've recovered. Can I get the infection again? From what we know as of now, and we have a good 3.5, 4, we have a good close to 6 months of experience with the virus now, considering that the first cases were detected somewhere in January. It does not look like a major problem. There are cases that have been described where individuals here and there have had the virus twice. It's difficult to know whether it's the same virus that was detected again in the tests, because the tests are very sensitive and can detect dead virus as well. But there have been cases reported of individuals who've fallen sick twice and actually have found to have the virus. But again, these cases get reported because they are the exception. If they were the norm, this would have been what we were seeing everywhere. So it does seem that occasionally, in a rare subset of people, this might happen again. But by and large, it seems that most individuals were protected once they had the infection. The next question that I get is, does a recovered person transmit? So based on what we know, again, from our knowledge so far, is that most of the transmission happens in the first 10 days since you acquire infection. So the day I have a fever today, for about 10 days from today, I am quite infectious, maybe a couple of days before that. So that's kind of the period of infectivity, which is where the whole concept of home quarantining for 17 days comes. So we're being cautious in India. We're saying that we know that it's about 10 days, but we'll add an extra week to be extra careful. So which is why if you are sick today, or you had fever today and you got swabbed and it turns out that you are positive, the advice is that you have to home quarantine for 17 days, because most studies have found that it's very unlikely that you will transmit after 10 days, even less likely after 17 days. So I do not think that a recovered person, in that sense, a person who's completely past these 17 days, is likely to transmit. So I don't think you need to quarantine that person further, or I don't think you need to take any extra precautions while interacting with such a person. A question I have is about residual lung disease. So what about, I've had a corona infection, I've had a corona pneumonitis, a pneumonia, I have recovered from it. Will my lungs be normal? And the answer to that, unfortunately, is that I think luck plays a big element in that. Some individuals heal very well, even when you do their X-rays at the time when they get discharged from the hospital, their X-rays start looking normal. But some individuals are left with scarred areas in the lungs, and those areas which have scars do not move oxygen very efficiently across. So when a person takes a deep breath, when the air goes to an area in the lung which has scar tissue, the oxygen does not move very well across that. As a result of which, whenever your oxygen demands increase, such as intense exercise, a person might struggle. There is unfortunately no way to know in advance who will go in which direction, who will have more scars, who will recover well. So to answer the question, you is like most lung diseases, like most pneumonias, tuberculosis, most lung diseases, there is always a probability that you're left with some scarring because lungs do not regenerate very well, and that scar tissue may not be normal. So one of the important questions, and I think this is very important to Mumbai and to metros in general, is about people who help us at home, our home help. I had a question saying my home help has gone out of town, gone back to her village. Do I get her back? Uh, well, the answer to that is just like people from here, migrants from here going back to their hometown, there is a procedure in place that if somebody comes back in here, they are supposed to get tested. They are supposed to be quarantined for 14 days. If they don't develop symptoms and the test is negative, they are back into the community. So I think that's the process in which you bring them back and ensure that they're not infected. What about day health? That's another question that I get asked. That individuals who come to the home in the morning do help out with the utensils, help out with the dishes, help out with household work, and then return back to their homes. What about them? There is unfortunately no easy answer to this. There is no way. Uh, you do a swab today doesn't mean that they're not infected. I mean, they may not be infected right now, but they could get infected 2 days down the road. So there is unfortunately no way of ensuring 100% protection to be absolutely certain that the person doesn't have it. What I would suggest is the same common sense precautions. The person who enters your house should be the person who enters your house should be wearing a mask at all times while they are in the house. It would be good if you could wear a mask as well while the person is in the house. Avoid prolonged contact. So if they are coming to your house and working, you try and avoid just sitting, standing and chatting with them for a prolonged period of time. Make them understand that this is being done both for their protection as well as your own protection, so that they don't feel. I'm sorry, I think my voice is cracking up. So make them sure that they understand that this is for their own protection as well, if it is possible. So, for example, if you have somebody coming to your house to do the dishes, if you could tell them to enter straight into the kitchen, do the dishes, and leave. I'm just going to pause this for a minute. So, if you can tell them to do the dishes and leave and then wait for about 15-20 minutes so that if there are any droplets hanging in the air, droplets will settle down. And then you enter the area. I think that will be useful as well. But do remember that when it comes to people working with us, we are as likely to transmit it to them as they are likely to transmit it to us. So let's be sensitive about not just assuming that anybody who enters our house can potentially transmit it to us and think of ourselves as being immune in some ways. So if you are asymptomatic as well and somebody comes to work in your house, it would be the right thing to do that you yourself wear a mask as well to make sure that that person isn't exposed. So avoid prolonged contact, limit contact as much as possible. Try and make people work in areas where there is not much interaction. Wait for some time while they leave. Have the person wear a mask and wear a mask yourself. So the next question I get asked is about treatment. So I have unfortunately seen prescriptions with some 10 drugs written on it for COVID. Unfortunately, I say the same thing today that I said 2 weeks back. There is no treatment. So most of the individuals, even in a hospital, the right thing to do is to put them on oxygen to observe them and There are certain drugs which are being trialed. There are certain drugs, we are doing drug trials to see if certain drugs work, but there is no definitive answer right now. So if you're at home and you're being quarantined, you definitely should not be on any drugs because there is nothing that has shown to benefit people sitting at home. If you're in a hospital, your doctor might want to trial certain drugs. They will take your permission. They will ask you if you're okay with that. And I think it's fair to get enrolled in drug trials. The next question I got asked was about the monsoon coming up. So the monsoons are right around the corner. There are a lot of diseases that come with fevers in the monsoon, and that is going to happen. Unfortunately, there will be no way of knowing whether it's corona or whether it's something else. So I think everybody who gets a fever in the monsoon, unfortunately, will have to get swabbed. Same precautions as you would take for any other disease. You need to constantly keep washing your hands, and the masks hopefully will protect us from a lot of other viral infections as well. Ask your doctor about the flu vaccine. Ask your doctor about the pneumonia vaccine. These are two vaccines that you should consider, especially if you're elderly. There are certain groups of people who are strongly recommended to have the flu vaccine and the pneumonia vaccine. Ask your doctor about it. The flu vaccine, in principle, is not really contraindicated. Everybody can receive it. There's nothing bad in receiving the flu vaccine. The monsoon is the season for influenza in India, so we recommend it just before the monsoon. So this is the right time to receive the flu vaccine. The pneumonia vaccine, on the other hand, we generally recommend to individuals who are above 65 or individuals who are above 50 but have other diseases like asthma, like respiratory diseases, like heart disease. So I think I've kind of summarized what I wanted to summarize in terms of answering the questions that have been asked. Again, I can't reiterate it enough that this is not a disease that one needs to be paranoid about. But fortunately, this is a disease in which we can do a lot to protect ourselves. And I think as long as we do that, as long as we stay sensible, as long as we constantly balance our own risks with the benefits of behaviors that might be detrimental to us, I think most of us are going to be absolutely fine. So again, I'm happy to take more questions. Maybe we could do another session in a week or so. Till then, I wish you all the best. I hope everyone stays sensible, stays safe, and stays calm. Thank you.